So HIV management in Australia and worldwide is really focusing on two areas now, one being prevention and the other being management of people who have established HIV infection. We are at a time when the treatments are just so phenomenal now. The side effect profile is low and the effect of those treatments in managing HIV is so profound that we see our patients living healthy lives almost completely unimpeded. Now, we don't have a vaccine, but we have some really amazing treatments and prevention strategies, including PrEP and PEP, and both of these can be explored on the ASHM website where guidelines are readily available. So PrEP refer to pre-exposure prophylaxis. This is patients who are not HIV positive but may be at risk, is where we provide the HIV medications to patients on a daily basis before they encounter a potential exposure to HIV, hence the pre-exposure prophylaxis. PrEP is something that patients can take indefinitely, and it's an excellent way of preventing HIV infection. So the great thing about PrEP is that unlike HIV medications for people with an established HIV infection, PrEP is available to all GPs with a prescriber number. So PEP refer to post-exposure prophylaxis. The difference with PEP being that somebody who's not taking the medications who potentially has an exposure to HIV has a 72-hour window to start those medications, and that therefore serves as the prophylaxis following that encounter. Now, PEP is available through every emergency department in South Australia of all public hospitals, and it is available also at places like the Adelaide Sexual Health Centre, Shine SA and other community clinics. A lot of GPs will first say, I don't think any of my patients would fit that criteria. What I would say to you is you may have a lot of patients who are interested who haven't flagged that they may be at risk because they're embarrassed or they're not sure how to bring it up. So I would always encourage GPs with an interest to be transparent about it. Put some information out in the waiting rooms or even do something through your social media or website to flag to the public that the management of HIV and the prevention of HIV through PrEP is one of the most rewarding and actually straightforward pieces of medicine that you might do, particularly when you get familiar with the guidelines. There's also some terrific people you can speak to who will be happy to guide you through the process through the health department, even private practitioners such as myself. We're always really keen to build our team of PrEP prescribers. If you're a GP working in the country, please know you've got a lot of support around you. The city doctors at the hospital are only a phone call away, and you will find that people working in infectious diseases and HIV medicine are some of the most approachable doctors you will ever call.